Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. So today we are here with Urinary System Part 4 session. In last 3 sessions we have already covered the topic of anatomy of the kidney, the structure of nephron and the anatomy of ureter. So today we will discuss the anatomy of urinary bladder. If you want to review the last 3 sessions, then please go through the link which is given in the description box. And this is the outline of today's session. The urinary bladder is hollow, distensible, muscular organ which is situated in the pelvic cavity posterior to the pubic symphysis. In males, it is directly anterior to the rectum, and in females, it is anterior to the vagina and inferior to the uterus. Urinary bladder is smaller in females because the uterus occupies the space just superior to the urinary bladder, and the folds of the peritoneum hold the urinary bladder in position. An empty bladder is tetrahedral in shape and it has the following parts. Apex, which is directed forward. We can see in the picture. Please see the picture. The base or fundus directed backward, and neck. That is anatomically, neck of the bladder is defined as the lowest point from which urethra begins. Next. In male, bladder neck is surrounded by the base of prostate. So we can see in the picture. And in females, it lies at the lower level and comes in contact with the superior fascia of urogenital diaphragm. And physiologically, the bladder neck includes the entire female urethra and prostatic part of the male urethra, because the detrusor muscle of the bladder extends up to this level. We will learn about the detrusor muscle in next slides. Next is surfaces. In the bladder, there are 3 surfaces: superior surface, right inferolateral surface, and left inferolateral surface. So we can see in this picture, there is the superior surface and here the inferolateral surface in both sides. Next, coming to the borders. So we can see in the pictures there are 4 borders in urinary bladder, 2 lateral borders, 1 anterior border and 1 posterior border. First, let's see the anterior border. It extends from the apex to the neck of the bladder and separates the inferolateral surfaces from each other. Okay. Next is posterior border. It separates the superior surface from the base and extend between the entrance of the 2 ureters. Okay. Next is lateral border. Each border separates the superior surface from the inferolateral surface and extend from the entrance of the ureter to the apex of the bladder. The bladder varies in its size, shape and position according to the amount of urine it contains. When empty, it lies entirely within the pelvis, but as it fills, it expands upward into the abdominal cavity and reaching up to the umbilicus or even higher. So a full bladder is ovoid in shape and has an apex directed upward towards the umbilicus. The urinary bladder's ligaments are divided into true ligaments and false ligaments. True ligaments are made up of fibromuscular tissue, while the false ligaments are peritoneal folds. So these are the name of the true ligaments and false ligaments. Next, coming to the interior of urinary bladder. There is a small triangular area over the lower part of the base of the bladder. The mucosa is smooth due to its firm attachment to the muscular coat. And this area is known as the trigone of the bladder. We can see it in the picture. The apex of the trigone is directed downwards and forwards. The internal urethral orifice opening into the urethra is located here. That means the anterior corner of the triangle. And the ureters open at the posterolateral angles of the trigone. That means two posterior corners of the triangle, and their openings are 2.5 centimeter apart in the empty bladder and 5 centimeter apart in a distended bladder. Next, histology of urinary bladder. There are three coats make up the wall of urinary bladder. The deepest is the mucosa, a mucous membrane composed of transitional epithelium and the underlying lamina propria similar to that of the ureters. Rugae, the folds in mucus, are also present to permit expansion of the urinary bladder. And the intermediate muscularis, also called the detrusor muscle, which consists of three layers of smooth muscle fibers, the inner longitudinal, middle circular and outer longitudinal. Around the opening of the urethra, the circular fibers form an internal urethral sphincter. Inferior to it is the external urethral sphincter, which is composed of skeletal muscle and is a modification of the deep muscle of the perineum. The most superficial coat of the urinary bladder on the posterior and inferior surface is the adventitia, a layer of areolar connective tissue that is continuous with the ureters. And over the superior surface of the urinary bladder, there is a serosa, a layer of visceral peritoneum. Next, coming to the blood supply of bladder. First is arterial supply. Superior visceral artery, which is a branch of internal iliac artery. Inferior visceral artery, a branch of internal iliac artery, and it is replaced by the vaginal artery in female. Obturator artery, a branch from the inferior gluteal artery, and in females the uterine artery, are the source of blood supply to bladder. Venous drainage includes veins from a vesical plexus which is situated along the inferolateral surface of the bladder in the space of Retzius. That is the extraperitoneal space located posterior to the pubic symphysis and anterior to the urinary bladder. And finally drains into internal iliac vein through the posterior ligaments to bladder. Next, coming to the lymphatic drainage. The lymphatics of the bladder drain into external iliac lymph nodes which are arranged in three groups: anterior, intermediate and posterior. From the apex and inferolateral surface drains into anterior group, from the upper surface drain into intermediate group, and from the base drain into posterior group. Next, coming to the nerve supply, the bladder is supplied by both sympathetic and parasympathetic divisions of the autonomic nervous system. Sympathetic includes the preganglionic motor fibers, postganglionic motor fibers, sensory cell bodies located in dorsal root ganglion of 11th thoracic to 2nd lumbar spinal nerves. And the parasympathetic includes preganglionic fibers, cell bodies are located in dorsal root ganglia of 2nd sacral to 4th sacral spinal nerves. Each division possesses motor and sensory fibers. The last part of this topic will coming soon. If this content is useful for you, then please put a like and share it with others. And for getting more videos like this, You can subscribe NG's Corner for nurses. And for any queries or any suggestions, you are most welcome to comment. Thank you for listening.